Hello and welcome to another edition of Simply Free Little Talk on Health Matters. And today, again, we have the wonderful, incredible Dr. Kenya here, and she's going to share some valuable information once again about common labs. Dr. Kenya, how are you?
Hi there, Free. How you doing?
I'm great. Good to see you. Ready to hear
Good
some
to
good
be
information.
seen. You say
Yes,
good to be seen.
absolutely, it is. So, you're going to share with us about common labs.
Absolutely, absolutely. You've got some people who are pay out of pocket, right? And then others who have insurance, and sometimes they want to try to pick and choose what lab panels they're going to do without understanding why we generally need a basic set from the very beginning. And so, my intention today for your audience is that I talk them through these labs, tell them which ones are most important for them to pay attention to and why we order them.
Okay. Well, go for it. We're ready to hear. We need to know.
Perfect. So I'm going to start with if you could help us with being able to see the slides.
Yes, we can do that. That's not a problem. There they are.
All right. And so over here with the total cholesterol, okay, this whole thing would be considered a lipid panel, okay?
Okay.
And I'm actually going to skip that one and go back to the CBC first, okay?
Yes. I often
This
hear that one.
So the CBC tells us a little bit about leukemias, lymphomas, anemias, possible infection. And if we do a full breakout, we can also know a little bit about allergies or sensitivities, okay? It's not specific, it just is an indicator that more things need to be done. So you will frequently see a CBC ordered when you are first meeting the physician. So let's break that out for you a little bit.
Okay.
So the first one here, WBC count,
Yes.
that one tells us about your white blood cells. Those are your fighter cells. You know how like right now Ukraine's in a war?
Yes.
Okay, so they've got their armies going out and fighting. That's what your WBCs do. Now,
Mm,
those can go up or down and mean different things.
mm,
When it is very low, it could be that a person is suffering from immune suppression of some kind. When they go way up, it can be infection, it
mm,
could be leukemia. And so you will frequently see that WBC broken out into something called neutrophils, lymphocytes, monocytes, eosinophils. You may even see the word basophils or granulocytes. What I want your audience to know is that it is not your responsibility to try to interpret those. If you go online and try to look that up, you're just going to freak
mm.
yourself out. Okay.
We don't want to do that. Thank you for explaining that to us.
It's like, please allow your doctor to explain it so that they can put it in the context of the rest of your medical record. You go online and start reading stuff, you'll come in and you'll be sweating bricks. So I'm about thinking that you've
We don't
got
want
it
that to happen.
honestly. So, anywho, you can think of those that I just called off: the neutrophils, lymphocytes, monocytes, granulocytes, eosinophils, basophils. Okay, those are your different types of warriors. Okay,
Mhm.
so just as we have an army that goes out and fight, and there's different rankings. Okay,
Yes.
Each of those cells make up a part of our immune system. And you guys, there's many, many more, but these are the ones that you will commonly see broken out on your CBC. Okay. If it says CBC with differential, that's when you will see the full breakout. Okay.
Okay.
All right. Now let's keep going. So we talked about the WBCs. Any question with that, Free?
None, not at this time. Everybody's, I think we're still shocked about going outside of our doctor to find information. We're going to stick with what you're saying, Dr. Kenya.
I mean, I'm a believer in educating yourself, but seriously,
Definitely.
before you go freaking out,
Uh,
you really should allow your doctor to really analyze those labs in the context of your medical record. So, the next lab, hemoglobin. Hemoglobin, that's the one that actually tells us that, along with the hematocrit, tells us whether or not the person is anemic.
mm,
So a lot of people come in freaking out about this RBC. To tell you the truth, we don't care about that one. Okay. What we look at is your hemoglobin and your hematocrit. Those are the ones that you as lay people can also pay attention to. Now, if it's low, okay, if both of these are low, then that means that the person has been losing blood or low in blood for a long time.
oh, that's not good. Ooh.
Right. So that means that instead of blood being low or iron being low for just like days, if both of those are down, that means it's been going on for months.
Uh, not good.
Now, if your hematocrit is normal and your hemoglobin is low, then that means that you've got an acute loss.
Hmm. Wow.
Okay.
Scary.
Now, if you see that the hemoglobin is high, some people might think, oh, yeah, I've got more red, I've got plenty of iron, I've got plenty of blood, but too much is not always good. What do we say?
Yes.
Do not supersize.
Do not supersize. I love it.
Do not
Even with the blood supply.
That's right. And I'm going to come back to that statement
Okay.
again when we get to your cholesterol, okay?
Oh,
But let's hold here with that hemoglobin for a second, okay? So if your hemoglobin is too high, being outside of that range of 15, then we need to start thinking about dehydration.
oh.
Maybe the person is a smoker. For some reason, their body's not getting enough oxygen, and so it's making more red blood cells. Okay. Hemoglobin is extremely important for carrying our nutrition, for carrying our oxygen. Okay. Those are the two main things that I want to focus on for our audience. Now, it can also be labeled as a disease. I'm going to use the word disease called polycythemia. Let's say it together. Polycythemia.
Themia.
Okay, one more time. Polycythemia.
Kali. Themia.
Okay.
I'll try that also.
So polycythemia is when your hemoglobin is up high, and it really can be something more. It could be a cancer, and then, like I said, it could be that the person is a heavy smoker, or that for some reason they're not getting enough oxygen to the body. It can also be due to a condition that's called Wilson's disease. Okay.
Oh.
Where you are storing too much iron.
Mm.
Remember what I said? Supersizing is not always good.
It's not
Not at
always
this
good.
time. Most
Oh,
times it's not good. Okay. So too
oh,
much iron can also cause problems. When
yeah.
we have too much of these things, it puts you at risk for blood clots. Okay,
Wow.
very good. And so your blood gets to be too thick, is what's happening. Okay,
Mm.
let's look now. MCV, MHC, MCHC, and RDW. You guys leave it alone. Don't bother with trying to understand what that is. Okay.
Wow.
Let us deal with that. Free, can you move our pictures over to the right side of the screen a little bit? There
There
we
we
go.
are.
So take a look, crew, at the platelet count. Now, your
Mm.
platelets are really, really important for helping
Yes.
you to not bleed to death. Okay. So if you're just spontaneously getting nosebleeds, or if you get a cut that seems to bleed too long, you need to go and have a CBC done. Your
Mm.
platelets may be low. And there's lots of different reasons why that can happen. We call that thrombocytopenia. Thrombocytopenia.
Yeah. Yes.
Mhm.
Wow.
And so again, a clue that that might be happening is your plates be you're having bleeding. Okay, a lot
Mm.
easier or longer than usual. Now your question might be, what can make that happen? Remember
Wow.
what I said? Supersizing is not always good. Okay.
Supersizing is not always good.
All right. So for those of you who take like fish oil products,
Mhm.
glucosamine, chondroitin, aspirin, all of these types of things, it can put you at a bleeding risk, and it can make your platelets go low. Okay. There's also called idiopathic. It does not mean that you are an idiot. It means that we in the science world are idiots. We don't know why it's happening. It's just happening.
Unexplainable.
Okay.
Unexplainable, right?
Idiopathic thrombocytopenia. Okay. That is a very common diagnosis, especially in women as they start getting into their 20s and 30s. Okay, but it can happen at any age, so don't be fooled. We usually have
Okay.
to treat that using steroids to help the body to stop attacking the platelets.
Okay.
Now, here's the other thing. When those drop below 30, that's critical. That's critical. We usually have to transfuse platelets at that point. I mean, literally, you can sneeze and cause intracranial hemorrhaging. You
Wow.
can bust vessels in your eyes, because remember, those are some of our smallest ones. Okay. So
Yes.
that would be
Mm.
critical. All right. Any questions with this panel?
No. No, we don't want to bust any vessels.
No, 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 we don't. Then
Wow.
there's also, though, where the platelets can be too high. And
Mhm.
so remember, we said there again, that can be a problem. That one would thicken or make you more prone to clotting.
Oh,
And so if you're clotting easily, what did we say that could cause?
mm. It wouldn't be good at
It
all.
wouldn't be
I tell
good. It can cause heart attacks. It could cause blood
you,
clots in your legs, anywhere in your
so many
body, your
things.
lungs, okay, or even a stroke.
Mm.
All right, let's move on to our
Not
next
good.
panel.
Not good.
Okay, so with this next panel, this would be a typical lipid panel.
Hmm.
And we usually do this so that we can have a clue about what direction your cardiovascular health is going. I like this. I got all of this off of Microsoft Bing Images, and
Hmm.
these were free. And I've also got that disclaimer at the end. So any of you guys could go online and see these. All right.
Wow.
Now, I like this image because it's got optimal,
Mhm.
intermediate, and high.
Okay.
So let's understand it a little bit more. Let's start
Yes.
with these LDLs, okay?
Okay.
Now,
LD.
I teach my patients to think of LDLs as your low down dirty lipids. You want it to
Mm.
be low, 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 low.
I love it.
Okay. Because those single-handedly are just so nasty. They can
Yeah.
really clot up your blood vessels, and
Yes.
they are the things that can cause your heart attacks, strokes, and things like that. Okay. So
Mm.
low down dirty lipids. That's the way we're going to remember those.
That's the
Low,
way
low, low, low.
we remember.
Okay. And then you can see over here to your right under the green zone
Yes,
that
I see
optimal
that.
is less than 130. Now, for our audience, understand that if you've had a stroke or a
Mm-hmm.
heart attack or some other conditions, generally this needs to be even lower than that. It needs to be lower than 70.
Wow.
Okay. And so this is where meeting with your doctor, talking with your doctor, helps, right?
Yes.
Because then you'll better understand why they're continuing to go up on your cholesterol lowering medicine despite you being in what's perceived to be normal range. So understand your personal goals for your numbers, know your numbers,
Know your numbers.
yep, and know your goals for those numbers. And that will be determined between you and your physician.
Yes.
Now, let's go to the next set of really important labs, the
Yes.
HDLs,
Okay.
high density lipids, heavenly lipids. Hallelujah, hallelujah.
I love it. I love you. Are so funny, Dr. King. She makes it exciting, right, guys?
So your HDLs, okay,
Yes.
your heavenly lipids, those are awesome because they do their best to help you out by going around and eating up the bad cholesterol and trying to take it out the body.
Help us out.
That's, yes.
So they help us.
Yes, they do. So these can be as high as we want because hallelujah, it's good.
Okay.
Now you guys will never forget HDLs, okay?
Oh my
So,
goodness. We would never. Hallelujah.
now there's certain foods that can help with increasing your HDLs. So we
Okay.
talk about omega-3
Yes.
fatty
Hear
acids.
that a lot. Hear that a lot.
Yes. Omega-3s, you can find that with your large fish, some with your
Okay.
medium fish. You can also find it with certain nuts like walnuts, pistachios, and almonds. Also, macadamia nuts. Okay, these all have good omega 3s. Also, avocado.
Yes, I love avocado. Love it.
Yes. But remember, too much of anything can be bad. Too
Okay.
much HDLs, though, is not too bad, but too much avocados can be.
Oh no. No
I
supersizing.
know. Supersizing. Very good. Okay. All right. Now there's another way. So anything that increases omega 3s. Okay.
Okay.
The second most common way to increase your HDLs is a niacin rich diet.
A nice and rich diet.
That is correct. So now the audience is saying, oh my God, well then should I go to the grocery store, go to the vitamin section and buy me some niacin? Oh, crew, come on, people. Now I've already told you that supersizing is not the best way.
It's not the best way. Interesting.
Honestly, if you can eat it, that is the very best way because then you're going to get your fiber too, which will help to clean that gut. And we talked about that in an earlier session with colon cancer.
Yes,
Okay.
you did.
So, niacin rich foods are going to be your super green leafy vegetables and
Yes.
then also your lentils.
Oh.
Now, for those of you who are going to try to supplement and go get the vitamins from over the counter, understand that a side effect of that can be hot flashes. Literally,
Oh,
you can
wow.
feel like your head is on fire, turn beet red,
Interesting.
break into a sweat. So
Wow.
you want to for sure get the slow release niacin,
Mhm.
and you like to be
Slow.
talking with your physician about the proper dose for you to start with.
Wow. Once again, that's that communication with your physician.
Exactly. Okay, so we said two ways so far: omega 3 fish oils, number
Mhm.
two, niacin rich foods. Okay, now there's a third way: exercise.
Exercise.
Fitness.
Really important.
Yes, we must
Extremely.
exercise. And you guys, that doesn't have to be going out and lifting weights. Literally, walking 2.5 hours a week, brisk walk. It's a
Mhm.
brisk walk, 2.5 hours a week can help with increasing those HDLs. So
Excellent.
now let's go to our next important one, which is the
Yay.
triglycerides. Triglycerides. Here's the way you guys are going to remember this: anything that has GLYC or GLUC, think sugar.
Ah,
Sugar, 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 sugar. Anything happy food,
really
okay? It is your fun food. Triglycerides are your fun food. Literally,
fun food.
anything that you can buy in the checkout line at the grocery store,
Mhm.
you know how they have that stuff sitting there?
Right
All
there
of
for you,
that stuff.
making
Yes.
it convenient for you to pick it up.
All of it will increase your triglycerides, okay?
Wow.
All of it.
It's a
Now,
trick. It's a trick.
it's yummy. That's what it is.
Yes. Yes. Absolutely.
I usually
Guilty.
tell people that if they're cruisers, if they go on cruises,
Mhm.
usually almost all the foods there are going to be high in triglycerides. I tell people, please don't get your cholesterol panel done right after your cruise. Can you please wait a month and then get it done? Because the numbers are just out of whack. Because you know how
It's
those
really
cruises
something.
are. It's like you could just eat anytime you
Wow.
want. You've got
Nope. This is
everything
not good.
there. Okay.
It's not good for us.
Your sweet fats. So remember that there's other carbohydrates that break down into sugar, and some of those break down really fast. Things like bread, pasta, rice. I'm not telling you that those are bad for you,
Yes.
but you definitely want to be moderate and temperate because you want to try to keep them less than 150. Now, your question might be, what are some things that this can cause when it's too high?
Yeah,
Well,
that's true.
outside of cardiovascular disease, it can actually cause pancreatitis. When you
Mm.
start getting to numbers like 500 and plus, that
Mhm.
person's at risk for pancreatitis. And people, that is not fun. It does
Not.
not feel good at all. You will have intense pain in the center of your abdomen. You will
Ooh.
have loss of appetite. You will be vomiting. Okay.
Not good.
So that's just not good. Don't do that to yourself. All right.
Mm.
And then all the rest of it for your team of people, I would prefer that you guys leave that to your doctors because we start talking about ratios and all of that. Discuss that with your physician. Okay.
Yes.
Discuss that with your physician. All of those ratios help us to know how at risk you are for a
Yeah.
heart attack. Now, if heart disease runs in your family, and let's say you're in your 30s or 40s, an additional test that you may want to get that I've not listed here is
Yeah.
homocysteine, right? Or HS-CRP. Those are some markers that tend to run in families and will show that a person is a bit higher risk for cardiovascular disease. So this is a beginning panel, all right? And there's so many
Yes.
more that can be ordered, but understanding the basics. Moving right along. I like this one because it's got the sad face and the happy face, right?
Yes. And I
So
love the red and yellow and green colors.
that's right, that's right, that's right.
Under control
So
here.
there's something called glucose, but then there's also something called a hemoglobin A1C. Well, there we go again, people. We got that word hemoglobin. Remember, I told you hemoglobin is important for carrying oxygen, sugar, nutrients. Very important. So, in this case, we're looking at how much sugar the hemoglobin has been carrying over a
Wow.
period of 3 months. This gives us a 3 month average in general.
So 3 months.
Yes, which is far better than just a glucose level.
Yes.
Okay. So the glucose level is our initial screen, and that's in generally a comp panel. We'll come to that in a bit.
Okay.
That only tells you what that person's sugars are at that moment. It can literally change at any point in time.
Wow.
Okay, so the hemoglobin A1C tells us average over 3 months. All right, so anything less than 6.0
Mm-hmm.
is
Wow.
not a diabetic,
It's
but
not. Okay.
is not. Okay, once you hit 6.5 and up, you are
Yeah.
now a diabetic. Okay. So the
Wow.
closer you're getting to 6 or 6.5, that is pre-diabetes.
Yes.
And so that's when we start talking about pre-diabetes. Once you cross 6.5, you're labeled as a diabetic. Okay.
Change of appetite and everything.
Correct. Correct. Now, look here where we say good. Okay. I would have preferred to see that say okay.
Yes.
Okay, not good.
Not good.
When you
Wow.
start getting a hemoglobin A1C that's greater than, I'm going to say 10,
Mm.
you're really putting yourself in danger. That means that you're more susceptible to getting fungal infections, bacterial
Mm.
infections. It may take you longer to heal when you get cuts.
Wow.
You may get more urinary tract infections. You start getting um, indigestion more,
Mhm.
feeling bloated more. Why? Because your body's being poisoned. You start actually shutting down your gut when it's been going for, when you've had numbers like that for a long period of time, you cause a condition called gastroparesis, which
Gastro. Okay.
means that you have messed up, you've
Mm.
messed up the nerves that supply your gut. And so it can't digest as well. And so the
Mm.
food rots before it can completely digest. We don't like doing surgery or any other things like that when a person's hemoglobin A1C is greater than 11. Why? Because it takes too long for them to heal. The person is more at risk for post surgical infections. So A surgery would only be done emergently if somebody was that high.
Hmm. Wow.
Does this help?
It is very helpful information. Very helpful. It's also kind of like, ooh, be
Yeah,
careful. Take care of yourself.
right. Let's go back to this slide. I skipped over it, I think.
Okay.
So this one is a comp panel. You'll hear us say comp panel,
Okay.
comprehensive panel.
Comprehensive.
This one, in a nutshell, is looking at your electrolytes. So that's everything listed from sodium, potassium, chloride,
Hmm.
calcium. Okay, those are all electrolytes. These become very important, especially these top three. Very, very important when we have hot Texas heat, okay, and people are
And it's
sweating
hot.
bricks. Oh my gosh, it has been. They're sweating bricks. They're not hydrating appropriately.
Oh, wow.
If they are, remember we talked about hydration in
We
a
did.
prior one when we were talking about solar protection.
Mm.
What can happen is you start losing your sodium. When you're sweating, you
Not
start
good.
losing sodium. When you have diarrhea, you lose
Mm.
potassium and chloride.
Not good.
Nope, not good because when these are off, you start feeling dizzy, you start feeling weak, and you can actually have a heart attack. So you'll start getting heart
Wow.
palpitations and stuff like that. Now, remember I talked about glucose. See that?
There's the glucose.
GLUC. All right, so GLUC, what is that? Is it a sugar? Is it a protein? What is it?
That's our sugar.
Yes, it is. It is a sugar,
Yes.
GLUC. Now, we had also said another way that you might see sugar indicated is GL what?
GL. Let me see if it's on here.
Ah, no, you're not going to look it up. This is a test to see
We
how
know
much.
the glucose is one. That's the one that stands out.
GLUC or GLYC.
GLYC. Hmm.
Haha, got you. I'm gonna come
She's
back.
tricking us up. She's tricking us up, guys.
You forgot, and that means that our audience would forget too. All right,
Yes.
moving right along.
Moving
BUN
right along.
creatinine, moving, moving, moving. Keep that wagon moving. Anywho, okay. BUN, creatinine, GFR, and E estimated GFR, all of this all the way down to
Yes.
eGFR. All of those are talking about your kidney function.
Yes.
There's
Kidneys.
one more that's listed here, that's not listed here, that's called microalbumin. Microalbumin. That one, mostly people who have hypertension or diabetes, this will be ordered through their urine and is extremely important as being an initial
So
sign,
that's a warning for us.
uh-huh, of
Uh,
kidney damage.
oh,
And folks, we've spoken about that a little
no.
bit in prior discussions. You can go
Yes.
back to Free Little Talks when we were speaking on
True.
diabetes.
On the diabetes. Wow.
Mhm.
All these signs to warn us.
Yeah. And so this becomes very, very BUN all the way down to EGFR, estimated glomerular filtration rate, is very important
Mm,
for understanding your kidney function. Now,
very
people
crucial.
always ask me, why do they measure non African American and African American? Why is there that distinction?
Hmm.
Because retrospectively, we found that there was that African Americans were dying
Yeah.
way often of kidney
Wow.
failure and having to go on dialysis. And these were people who had a physician that was overseeing their care. Well, thank you to all of those who went before us and actually volunteered to do studies, okay? Clinical studies help us, you all,
Yes, they do.
help us to know how to better care for one another
That's
in
awesome.
in relationship to their ethnicities. So, okay, now you know that they found that we were dying more often and having to be on dialysis. And
Mm,
so through the studies, they learned that they needed to set some different markers, okay,
okay.
some different standards. And so that is why we now break it out.
Wow.
It's so that we won't be missed. We, being African Americans, won't be missed at those early stages of
Yes.
kidney failure. Very good. So, this is all a blood test. And we said that through the urine, microalbumin can be checked. And those are that would be a very initial sign that the person is having kidney damage. Now, very bad would be when a person is actually leaking protein in their
Oh,
urine.
wow.
So you see, we've got protein and albumin here. This just helps us to know about a person's nutrition level.
Yeah.
So remember that protein is important. It helps us to build
Yes.
muscle, it helps us to do so many things. So when this is low, you're not going to have good healing.
Mm,
But you don't want it coming out in your urine. If it's coming
no.
out in your urine, then that means that that person is having kidney damage. The kidneys are very resilient. If we straighten up our act and fly right, the kidneys
Mm,
can't heal themselves.
they can heal themselves. Okay.
Hmm. And so if your doctor says, please follow up in X, Y, and Z time, this is what's going on with your kidneys, I need to recheck, honey, go on back. Go back and have it rechecked.
And have it rechecked. Mm,
Now, let's look at liver. I mean, the compound is so extensive. I don't think people really understand everything that's in this. The comp panel tells us so all of this right here, the ALK
mhm.
phos, the
Wow.
AST, the ALT, the bilirubin, these give us a snapshot of what's going
Yes.
on with your liver. Now,
Ah,
remember, the liver is extremely important for almost everything. It helps to metabolize our food, it helps to metabolize drugs or medications, it
wow.
helps with our clotting factors to keep us from bleeding to death, all kinds of stuff. It's vitally important,
Vitally
vitally
important.
important. And so we watch these markers for
Mhm.
if they're going up, if they're
Wow.
going up. So they can be clues that the liver is being insulted by something.
By something. Mm,
That's right. And so then we will start ordering more tests, more studies to figure out what that something is.
mm. So a lot happens through the blood.
Oh yes. Oh yes. It's our little snapshot. So those were the lab panels that I wanted our audience to be aware of.
We know
And
now.
don't be surprised if on your first visit with your doctor, they
Mm,
order these things. And
yes.
sometimes we will, or depending on how old you are or um, what your labs look like, we may order it every year.
Wow. To monitor, right?
Exactly.
Difference
Exactly.
in maybe
Not
last
every,
year.
yeah, not everybody needs it done every year. You've got younger adults like in their 20s that if
Mhm.
they have one set that's perfect, we'll usually wait about 2 years before repeating.
Okay. That's pretty good. So we have to understand the importance of these labs and why doctors order them. Thank you. You did a thorough job, as always, explaining these things to us. So now we know, and of always, you always bring documented evidence or props to show us. So thank you. Thank you, Dr. Kenya. You always educate us so well, and it's all about preventative um, health. We are preventing ourselves from falling into a situation where our health may possibly fail because we didn't go and consult with our doctor when we first start having symptoms. So thank you
Before you start having symptoms,
for
please, audience. Okay, before. Remember, Dr. Etim is all about the
yes,
before, and no
preventative,
supersizing.
no supersizing. Thank you. You made that clear, doctor. So have a wonderful, wonderful rest of your day. Thank you for taking out your time to explain to us about the common labs that our doctors order. And you were extremely thorough in letting us know. And you kind of got me concerned about some things that you said that could happen. She always have me like that because it's like we start thinking, wow, that can happen. Thank you again. That's
You're
Dr. Kenya,
welcome.
guys, of UT Health in Jacksonville, and we're just so glad she was here for Common Labs. This is Free Little. Your host is going to sign off today from Simply Free Little Talk Health Matters. Thank you again. Stay tuned. Dr. Kenya will be back with some more important information. Thank you.